Okay, so we're going to be drawing up medications. So we're going to do this outside the patient's room. So before you go into the patient's room, you want to check the MAR. You want to make sure you have the right dosages. So do your 6 rights of it. Do your 6 rights, which is right patient, right medication, right documentation, right dosage, right route, and right time. And you want to check for their allergies, make sure they're not allergic to like anything that would like in the medications at all. And you just want to double check everything before you go into the room. So I'm going to put on my gloves. Alright, the first one I'm going to draw up is Compazine, which requires an ampule. So when you have an ampule, you need to make sure you have a filter needle, which is this pink needle. And opening the ampule, you want to make sure that there's no medication up here. So if anything, you can just go like this really quick and there'll be no medications. Wrap it around here and make sure you pull away from you, and it usually cracks pretty easily. If I can crack it. There you go.
Are you ready?
Then make sure you put this in the sharps container.
I can like sit over here and do it like this way.
Okay. And this is the one we use. And check, it's 10 milligrams, so you're going to draw up the whole entire ampule. Tip it over.
I can do it on my iPad again.
I cannot do that.
You can do it on that. I have it either.
I shake when I do this. You want to make sure the top of the needle is still in medication, or you won't be drawing up any. So make sure that as the medication's being drawn up, you move your needle a little bit down. Alright, once you draw it all up, I drew up a little bit of air, so you push it back up.
And today I'm going to talk about...
Make sure there's no
I don't know.
air bubbles, and if there is, you just want to kind of flick it just a little bit, or you can take a pencil and kind of just tap it until all the air bubbles are gone. And then to put the top back on, you're going to do the scoop method. So go like this. That was a fail, sorry. Go like that. And then this, and then you have to change out the needle before you administer it, so make sure that you take out the filter needle and then put on a regular needle. And keep it in the package, so you just stick it on like this, and then you can take off the wrap. Alright, that's Compazine. The next one's going to be Dextran, which is a 100 milligrams a milliliter is the order, so you're just going to draw up 1 milliliter. Because the syringe is in milliliters, so you're just going to draw up 1 milliliter. Make sure before you do this that you take an alcohol swab and you wipe the top of it.
In this side, and all the other side, we inject up to 2 milliliters.
And you want to administer air before you draw up, so administer as much as you're going to draw up. So I'm going to administer about 1 milliliter of air.
Here, give me that. Quadrants into the upper right quadrant. Or you can draw a line from the posterior iliac spine to the greater trochanter, and it's going to be this right quadrant. So you can also
Again, make sure there's no air bubbles.
crest and
There we go.
that last one is
Scoop method again.
outer thigh muscle. So you can put a hand's breadth at
Alright,
the top.
and that is Dextran. And for the next one, it's going to be insulin, which was NPH and Humulin. So
So next we're going to do subcutaneous.
and the method here is going to be cloudy, clear, clear, cloudy. So you're going to inject air into the cloudy first, and then inject air into the clear one first, but then draw up your clear one, and then draw up your cloudy one. And the reason you draw up the clear one first is because it's fast acting. So you want to make sure you draw up the Humulin insulin first. Okay, so the needle for this one is in units because MPH is going to require 20 units and Humulin is going to require 10 units. So like I said, aseptic technique, wipe off both of them with an alcohol swab. Okay, and MPH is 20 units, so inject air, 20 units of air first into the cloudy one.
So intradermal, like I said,
And then do 10 units of the other one.
Subcutaneous, you're both going to do 25 to 27 needles.
And now draw up 10. Make sure there's no air bubbles.
Yeah, seriously.
Now drop 20 units of the other medication.
Okay, it's actually really
So you should have a total of 30
find
units.
greater trochanterium, and then find the posterior, like the dimples in your back, just your iliac spine. And then draw like a diagonal line. And then it's the upper
No air bubbles. Sorry.
your, like this part of your hand on the iliac.
That was a quick Friday, guys.
Alrighty. Scoop method. Alrighty. And now we're gonna do the Novolog pen, which is another insulin. And with this one, how many units you mark it on the side, so make sure you do that. And with this, you have to put one of these needles on here. So you open it, and you have to make sure the little needle inside touches this little bulb right here. So it screws on this. And then before you administer it, obviously you go to, first you have to prime it. So you turn it to 1 unit and then press it, and then it would go back to 0, and then you turn it to the right amount of units that you're administering. And then you have to obviously take this cap off. But we'll do that in the video where you administer it. Alright, and then the last one is PPD, which is this needle, and it's going to be 0.1 milliliters. So, use an alcohol swab. And it's 0.1, so make sure you do 0.1 milliliters of air.
I know.
Now, any air bubbles?
So you can keep the.
Scoop method.
Wait, you only need to know where the needle goes.
I could do it right. Yeah. And I would do the scoop method, but that was kind of hard. Alright, so those are all my medications that I just drew up, and the next video will be me administering them.